This program is provided for general medical information only. Viewers should not rely exclusively on information provided in this program for their own health needs. Our health professionals respond to viewers' inquiries with general information and do not act in any way as a viewer's physician. All specific medical questions should be presented to your own healthcare provider.
Hi there, welcome back. You're watching Ask the Doctor here on America's Health Network, and I'm Dr. Winnie King, your host. And for this first hour of the show, we're talking about strokes. This is a very, very important topic, and it's one that many people experience and know all too well about how frustrating it is, how frightening it is, how hard it is sometimes to communicate with the people in your life as to what you're going through. And you just heard from our very special guest, Barbara Newborn, who has written a very exciting book, Return to Ithaca. It's her journal of her travels through her recovery, and she unfortunately suffered a stroke, and suffered it at such a young age, at the age of 21, and she's a fascinating journal in her book to share with all of us. Now, every year, 500,000 Americans suffer a stroke, and nearly a third die within a year. However, scientists are finding new ways to decrease the risk of stroke. Sandy Hausman has details.
In 1992, Henry Michaels suffered a stroke. He was an active man, just 54 years old, so the blockage of blood to his brain came as a big surprise.
I was out on the driveway goofing around with some lawn work and I fell. I got real dizzy and I went down. And it took me about an hour to get in the house because no one was home, crawling.
Henry got prompt medical care and recovered, but many who have strokes are not so lucky. 1/3 will die, and those who survive may have lifelong disabilities. Now, however, studies show it's possible to reduce the risk of stroke.
If your blood pressure is high, it's important that it be controlled. If you smoke cigarettes, it's important that you stop. Smoking cigarettes will increase your risk of stroke by 500-fold. Certain medications have been shown to diminish the risk of stroke. Aspirin is certainly among the safest that has been shown to have that benefit.
In fact, studies show that aspirin, when taken regularly under a doctor's care, along with a regimen of diet and exercise, can help prevent recurrent stroke. What's more, a new study suggests a link between small strokes and the onset of Alzheimer's symptoms, underscoring the importance of stroke prevention.
The study was published in the Journal of the American Medical Association, and the conclusion, essentially, in a nutshell, was that the expression of Alzheimer's disease was directly related to the incidence of strokes in certain areas of the brain.
You may also be able to prevent a stroke if you know the signs of a transient ischemic attack or mini-stroke, a sudden severe headache with no known cause, dizziness, dimness or loss of vision, trouble speaking or understanding speech, and weakness or numbness on one side. If you have any of these symptoms, see a doctor at once.